Sickle cell disease is a blood disorder that affects blacks, Africans, Asians, and Latinos mostly. Sickle cell disease is rarely talked about, which is much needed to be talked about. It is a blood disorder that affects the way that your blood cells are shaped, which the red blood cells, instead of it being round and soft like it's supposed to be, it is crescent banana shape, and it doesn't flow through the veins as well as it's supposed to, which causes pain crisis. When sickle cell patients happen to have pain crisis, most of the time are landed into the hospital. Sickle cell disease can cause any of your organs to shut down, brain tumors, strokes, heart attack, and different things like that. Some people are unable to walk because of sickle cell disease. It affects so many people on so many different levels. Sickle cell disease is a disease that is the most genetic disorder in the world, not just in America, but in the whole world. Today, I have Derek Buggage and Kyrriel Derek with me today, and they both have sickle cell disease. There are many different forms of sickle cell disease, and there are two people that are carriers. Derek, what form of sickle cell disease do you have?
I have a SS form of sickle cell, which is one of the more, I guess, the most aggressive form of sickle cell.
Kyrriel?
I have sickle cell beta plus thalassemia, which is the second highest of all sickle cell.
Have you recently or in the past had any pain crisis that affected you in any ways, where you maybe when you were younger you had to stay home from school or wind up in a hospital for some time?
Definitely. I've had lots of pain crises that kept me out of school. Of course, this was a long time ago when I was actually in school, but over the years, there was never a year where I came in under the mark for a day's miss. So if there was 21 days that you could actually miss at that time, I would always come in above that every year. You know, I would consistently miss school, either with hospitalizations or just being sick at home those days.
Kyrriel?
When I was younger, I had to be in the hospital a lot. It was a lot of times that I was just in the hospital and missing school too.
How old are you?
I'm 41.
41. And how old are you?
I am 14.
14. When Kyrriel was born, the doctor told me that she would not live past the age of 5, which in October that's going to be 10 years past what they say, because they never really know. They could die at 5 months, they could die at 5 days, they can die at 5 years or 55 or whatever. I have a friend that died last October from sickle cell disease. He was 33 years old. He didn't complain much about him having pain crisis. He didn't complain a whole lot at all. He was a real down-to-earth person, loved and showed love to many people. But when he was young, as a young infant, he took with a stroke. And as he got older, he was always in the hospital and stuff too. Do y'all know anybody that actually died from sickle cell disease, or y'all don't really know many people that have it?
I know a few people that have it. I don't know, I haven't known anybody personally who passed away from it. Now, I have heard people dying from it. But now, my mom did have it. She had complications in the hospital, and she did die. They didn't say whether or not it was the sickle cell that actually took her life or whatever.
They probably didn't even know.
She had like pneumonia or something at the time, but everything was kind of brought on by pain crisis and everything else. So I guess they would say it was an contributing factor, but it may not have been the factor.
Well, that actually, when people die from sickle cell disease, is actually the problems that it actually caused.
Right.
And pneumonia being one of them.
Right.
A lot of people are unaware and uneducated on sickle cell disease, and that is the purpose of this whole show. Kyrriel?
I don't really know anyone closely with sickle cell. I'm the only one that I know of.
So, okay, going back to like for y'all hospital visits, how do y'all feel like y'all with interactions with the doctors? Do you feel like they actually care about you, or you know, how do you feel when you having a visit or something to the doctor or emergency room?
Okay, like down in this area or Thibodeau or Homer, those areas have been kind of like, I guess they kind of shun you away, so to speak. They're not really used to treating you. Okay, when I go to my doctor in New Orleans, they're more used to it. They're more equipped. They're more ready for it. So in certain areas, it's more difficult to get the treatment that you need, and in others, or more populated areas, I look at. And I'm just basing off of New Orleans because that's the main area that I went to, or that I go to when I want good treatment. You know, they're more used to it, and they actually help you a lot better. You know.
I have never actually really been to a local hospital for my sickness because I always been to my home doctor where they know everything about me. So but the time that I had to actually go, not like the hospitals down here, not really like my other doctors because one don't know something and the other one knows everything.
Have you ever felt like the doctors didn't really care, or they tried to push you away because they might have thought, because I get a lot of times, a lot of people that I've talked to that have sickle cell disease, they do say that they feel like as an adult, the doctors feel like they're just coming to the doctor because they feel like they want drugs, they want to get high, basically. Have you ever had anything dealing with the doctors like that?
I've dealt with that before. I'm not gonna say what hospital, but I was in Homer and I went to one of the hospitals in Homer, and they treated me and gave me some pain medication, IV fluids, and then they kind of just sent me on the way. But I was in a really, really severe crisis at the time. So I ended up leaving that hospital and going to New Orleans, to Tulane, to get treated. And I stayed in the hospital about 3 weeks.
Wow.
And received treatment for about 3 weeks. But that's how bad it was. And I still to this day don't know why they sent me home from that hospital rather than treating me.
Probably because they're really not knowledgeable of your condition and really your state, because Kyrriel was actually born in Homer and they recommended that she go to Tulane in New Orleans because they didn't have any doctors to accommodate her and her illness at the time. Yeah. So they actually sent her to Tulane, and we are an hour and a half away from Tulane in New Orleans. And you know, when she was a baby, we had to drive an hour and a half to get to the doctor. Now, since I found out the St. Jude Clinic was in Baton, there's also a St. Jude Clinic in Baton Rouge. Mm-hmm. Now we only have to drive 45 minutes. I actually know someone that drives all the way from Ruston, which is a 5-hour drive, just to go to New Orleans to Tulane to the hospital. Yeah. Because they don't have many doctors that deal with people that have sickle cell disease. And it's crazy being that, you know, it's the largest genetic disease in the world. And, you know, they accommodate people with cancer and lupus and all of these other diseases, and sickle cell is just basically brushed over. Do y'all even feel like, you know, sickle cell disease is brushed over at times?
Well, just from what I've been around and seeing how much isn't done about it, mm-hmm. or the lack of knowledge out there on it, you know, and this is from the medical field. You know, so I mean, I don't know if you getting into this later, but I turned to the internet to find out or find information from other people who's dealing with it, or parents, other people who actually have the disease. I try to get my knowledge from them, a lot more knowledge from them, because a lot of doctors just don't have it. But like I said, that's another reason why I go to Tulane and not in my area. I don't think to the area in which I live.
Kyrriel?
No one has ever really talked about sickle cell. I don't really know anything about sickle cell besides there are like about 5 stages of it. And that it's mainly African Americans and all that with sickle cell. Other than that, I don't really know anything about it.
Okay, let's talk more about the knowledge of sickle cell disease. From y'all understanding, what do you get basically about maybe having families or kids and stuff behind having sickle cell disease?
So, in relation to being with my wife, my spouse, well, me coming up, I actually didn't know a whole lot about it. I only knew from getting jobs, there's this, I guess, this description, well, you know, you can't stop someone from working based on having sickle cell or anything. But they used to have these charts up showing how, if one person had sickle cell, how would it go as far as their partner, and how the kids could have sickle cell or not actually have the disease, but actually have the trait. And then I went over some of that information with my doctor. But the main thing was that I didn't want to have my kids deal with what I'm going through. Okay, so in relationship to me having the actual SS disease, I knew that I needed to meet someone who was normal, who didn't have any form of sickle cell. And I also knew that them being with me, my kid would at least have the trait, but they wouldn't experience the actual disease itself. Which, I mean, it's not like that's such a great thing, but they wouldn't have to experience, or it would be less likely that they would experience what I had to experience coming up. Also, since I've gotten older, I noticed that a lot of people really don't pay attention to it. They really don't notice, or some people don't even know if they have the trait.
Right.
You know, most of the ones who have the disease actually know because they experience the pain. But a lot of people don't know if they even have the trait. And a lot of people don't care who they're with. So the disease continues easily.
Grow.
Exactly, because we don't pay attention to it as a group. You know, we're not being taught. It's not being passed down. The education and knowledge is not being passed down. You know, because if most people knew what their kids would experience, they would definitely kind of, I guess, educate themselves on what it is that's going on with this disease itself.
Kyrriel?
From my understanding, if I get married to someone that's normal, my child would either have the sickle cell trait or one of the diseases.
Piggybacking off what you said, you know, I agree with all of that. 100%. But like for the sickle cell trait, it's a stigma. You know, the doctors tell you that sickle cell trait doesn't affect your body at all. I have the sickle cell trait. I've had pain crisis since I was small. Actually, they started when I was around 11 years old. Sometimes major events or things happening in life that actually trigger them, where you go into stress or depression and stuff like that, it gets worse. But I dealt with it since I was 11 years old. The first time I actually passed out, I had chest pains and got overheated and actually passed out when I was like 12 years old. I was always I always had pain crisis. Never knew what was behind it, where it come from, or nothing like that until actually I got older, and I actually done my own research when I actually had my daughter. And you know, they tell you, the doctors themselves tell you that it won't affect you at all. So with you having sickle cell trait, you think, oh, it's fine, until like something major happens. You can be 50, 40 years old. Like I have a cousin that when he was like 48 years old, he actually found out that he had sickle cell disease because he went into a pain crisis. They thought he had lupus. They thought he had some other issues that was going on because his body was shutting down. But up until maybe 2 weeks or so, they found out that he had sickle cell disease when he was actually on life support. And when he found out that he did have sickle cell disease, you know, they didn't know anything about it. And then back then, they didn't really test people for it. And even now, they still don't test people unless you request it most of the time. Your doctor, you know, they don't test you for it. So if you don't have much knowledge of it, then, you know, it's nothing you can do about it. So that's the purpose, you know, bringing knowledge and awareness to sickle cell disease. I've had knee pain a lot. My legs used to hurt so bad where I couldn't even walk for a long time. When I was pregnant, I had a lot of episodes where I passed out and, you know, didn't even know at times. My children, only one, Kyrriel, has sickle cell disease. The other ones, to my knowledge, they don't have a trait or anything. With having sickle cell disease, it's a possibility that, well, it's a 1 out of 4 chance that you might have a child that have sickle cell disease or a trait. Even if you have, it have some people that have sickle cell disease that children have no trait, no disease, nothing. And it also have people that have 5 and 6 children that all of them have sickle cell, some form of sickle cell disease. Did your now wife, was she tested before to know if she had sickle cell trait or disease before y'all was married, or like how did you actually know that she didn't have a trait, or has she been tested?
I don't remember her actually getting tested. I remember, well, we had discussions about it, and which led to I guess me knowing that she was normal, and you know, and me having, you know, of course, the disease. As she would tell it, I got sick once, and we didn't talk for a while, and then we had the discussion later on, you know. But initially, when we first got together, no, we didn't have a discussion or anything. But we did after I had that first crisis.
And when you got sick, what happened that led y'all into that conversation about sickle cell? How did you bring up the conversation about sickle cell disease, or when I get sick, to the best of your knowledge?
I don't normally talk to anyone when I get sick. Like friends would call me up, or you know, relatives would call. You know, I just don't want to talk to anyone. If I'm in the hospital, I don't really talk to anyone at that time. You know, and she and I had just gotten together, and she was calling, and I didn't talk to her either. I wasn't hiding from her, but I just don't like to really associate with people when I'm feeling bad.
How old were you?
When we got together, I had to be around 20 years old.
20?
Yeah, I had to be around 20 years old when we got together. And I mean, I'm still like that till today. A lot of the time, if I get sick and I go to the hospital, friends will call, or family will call, and a lot of times it's hard for me to.
So you have people that's actually concerned about you, and you basically shut them out when you shut down.
Yeah, I kind of shut myself off from everything.
Yeah, why?
I don't know. It's just always been how I've been. I have no idea why, but I prefer to just keep to myself. And I think it's because of the level of crisis. I don't like to keep talking if I'm in pain.
Okay.
So
that's understandable.
I do know that they're trying to check on me, but I would rather just not talk at that time. You know.
Gotcha. So if they call and talk to your wife and ask how you doing and stuff, you don't have
definitely they can call and talk to her, but or someone else who knows
just
them
to
in the
check
hospital.
on you and stuff. You don't have a problem
Right,
with
I don't
that.
have a
You
problem
just don't
with
want
that.
to
I
talk
just
yourself
don't
because
wanna
you're in so much pain.
Exactly.
What about you, Kyrriel? When you get sick, have pain crisis, to your knowledge, how do you deal with, like, you want people to check on you, or you just really don't want to be bothered?
I don't really like talking to nobody either when I'm sick, because I just be more to myself, and that's kind of how I am when I'm not in the pain or whatever. I don't never really like to talk to people about my problems.
Why?
I just be wanting it to get to myself.
Why is it? Do you feel like people gonna judge you because of your problems or something? Like, why is it that you don't want to talk about your problems when you actually have problems on any
I feel
level?
like people will judge me about it.
Because you feel like people will judge you about it. Okay. Coming up, like when you were in school, did you have any problems with people like picking on you and stuff like that?
Oh, you mean bullying?
Mm-hmm.
I did have one bully when I was younger. When I was, I guess, up until about 8 years old, maybe 8 or 9 years old, something like. I think it was 8. But I want to say that was probably the only one.
Okay. With you dealing with a bully when at that age, did you like understand like your pain crisis and stuff like that when you were in pain, or when you had sickle cell at that age? Did you actually understand it?
I had a decent understanding of it. I'm not gonna say I had a full understanding, but I had a decent understanding because my mom had the disease.
Mm-hmm.
So being that she went through so much, she imparted a lot of stuff upon me so that I would kind of know how to deal with it a lot better. Mm-hmm. The drinking a lot of fluids, take your medicine, try to get as much rest as possible, all of those things, The one thing, I guess it's a good thing, but it was hard at the time, was even when I would experience tremendous pain crisis, and I do mean tremendous, on a scale of 1 to 10, if it was like a 9 or a 10, and say I couldn't walk, the pain was just that bad in my legs, she would still force me to get up and go to the restroom. And at the time I hated it. And I thought, what kind of person would do this? Well, nowadays, I'm a grown man and I'm at home. Well, when these same pain crises hit and they're that bad, like if my wife is at work, my kids are at school, who's gonna take me to the restroom? So now I have it in my mind
that understanding.
I'm gonna get there.
Right.
So her main saying was, I don't want you to be no invalid. I don't want anybody to have to carry you or take care of you like that. You need to be able to do it on your own. You don't know what you're going through right now. You don't know what's happening right now, but you're going to understand this later on. And
right.
I absolutely hated it. But now, I really, really appreciate it.
Big ups to mama, for real.
So, yeah.
Like, you appreciate it now. Because
I
you
really
know
do.
now.
Yes. Yes.
Kyrriel.
In primary school, basically every year, I've been bullied. I've been called black and ugly. I've been called bald-headed. I've been called everything that you can name about me. Never really tried to worry about it, but I've had a lot of breakdowns from it. There was never a time that I was never bullied.
With you for your bullying, from the time up until you made 8 years old,
Right.
did it affect you in a major way, or was it like you just brushed it off?
Well, with me, it kind of affected me. I would say it affected me mentally, more mentally, because, with bullies, with my bully, I didn't know if he was a friend one day and a foe the next. So
Same thing with her.
we would be fine sometimes, and then sometimes we just wouldn't be okay with each other, and I had no idea why.
9 times out of 10, because your bully was going through some things and they needed a friend, and so they wanted you to be their friend, but they wanted to bully you because they had nothing else to do. You know, and a lot of times they be jealous of you, and just like her, they call her sharp, black, and ugly. She's sharp. She's a beautiful black, and far from ugly, and she's been beautiful. And I had to do a whole lot of rebuilding and confidence rebuilding and a whole lot of reconstruction with her mind, because dealing with her bullies that tore her completely down. Kyrriel, what's some of the things, like, what was one of your worst episodes dealing with, you know, one of your worst effects dealing with the bully?
At one point, I wanted to kill myself, and I wanted to die because I was just getting tired because I was getting bullied a lot, and now I'm 14 years old, and to this day I'm still getting bullied.
Derek, you ever felt like you having sickle cell disease held you back in any type of way, and from doing anything? Did you ever feel like you was limited to anything, or, you know, basically, or how did your mama treat you as far as
My parents mostly treated me normal. I was able to do a lot of things, but the one thing that I wanted to do that I couldn't do was play sports. Okay, I wanted to play football. They wouldn't let me play football because they were worried about, you know, I guess concussions and other things that could happen to you while playing football. But they were really worried about the contact itself, and sending me into a crisis because of the roughness of the sport itself. You know, I still wanted to play, but they just wouldn't sign off. And then when you're in school, if your parents don't sign off,
right,
then you can't play. You know, you're not allowed to make that decision yourself. So that's the one thing that they wouldn't allow.
And that's the only thing you feel like that, you know.
I think it held me back in certain aspects with school as well, because, you know, if you're going to school, everything in school builds on itself. It's progression. So if you're at school for, say, a month, 2 months straight, and you're doing well in school with your grades, and you suddenly miss 2 weeks, well, you're 2 weeks behind.
Right.
So even though some of my assignments got sent home, subjects like math, it was kind of hard catching up in those subjects. So I guess you could say it kind of held me back in that stuff, you know, with education, as far as education is concerned. So,
Kyrriel?
It makes me forget a lot of things. I can't really remember it a lot from when I was younger. As far as school goes, I forget half of the stuff that I be learning most of the time. With sickle cell, I can't really be energetic like I want to, so I'm an inside person, and I don't really like to do a lot of active things.
What you like to do?
I like to dance, cheer. I would like to run track, but I'm just like even running just a little bit, maybe I'll wrestle. I can't really do that either. I can't really do everything that I want, like actually want to do it. So I never really tried.
And I can see how it makes you forget things too, because dealing with sickle cell disease, you don't get enough oxygen to your blood, and when you don't have enough oxygen to your blood, it's not flowing to your brain right. So that makes you not have enough oxygen to your brain, and when you don't have enough oxygen to your brain, you have certain cells in your brain that actually die, and memory is part of it. But some things you can do to help build your memories, like do like word puzzles, and different stuff like that, strategies that actually brainstorm and have you make you think, make you use your brain, there's a lot of different things that you can do to help with, you know, your memory and stuff like that too. What is some of your biggest fears, or do you even have any?
It's funny because I guess one of my main things, I guess, since so many things can happen with sickle cell itself, I worry that something would happen to me and no one's around to actually help me.
Okay.
Like that, we talked about the strokes or the organ failure or any number of things that can happen to you. Well, I guess if I had to name one, that would be one of my main things that kind of make me nervous. You know.
Kyrriel?
Having a pain crisis because for my doing having a pain crisis, then you can die from it in with sickle cell, and when I have a pain crisis, sometimes I just don't tell nobody or whatever. I just try to fight through it. But at the same time, I be thinking about me dying. I be thinking I'm gonna die because like sometimes it get that work.
Well, when you have a pain crisis like that, you gotta let somebody know. Because you're not saying anything, no one can help you. When you speak on it, you can get the care that you need. And always stay hydrated. I know you think water is not a big deal, but it is a very, very big deal. And water even actually helps your blood to flow. And it does. It helps a whole lot. When you've had pain crisis, what are some things that you did to manage your pain?
Well, it's most of the pain medication that actually helped me as far as dealing with the pain itself. But aside from that, it's just drinking a lot of fluid. It's just drinking a lot of water. It's not really a whole lot. I've tried things such as even flow and other herbs. But as far as them stopping the crisis, no, I haven't had any luck in that area. But I don't think everything works for everybody, of course. But it's mainly water and my pain meds, and of course getting lots and lots of rest. So.
Do you exercise in it?
Yeah, I do exercise, but I've kind of pushed it a little hard with my, with exercising. And at times I've caused myself to get sick from exercising, so I had to taper back and watch how much I actually push myself.
Yeah.
For instance, one time I did Insanity, the workout Insanity.
Yes.
I actually pushed through and did the whole workout, right? Well, after I finished this workout, I found myself going into a pain crisis, and of course, it was because I was going so hard. Anything I do, I try to do like
to the extreme.
Yeah.
I could understand why your mama didn't want you to play football.
And it kind of that's what got me in trouble.
Yeah, I understand why your mama didn't want you to play football. Same reason she couldn't play basketball anymore, because she don't know how to say I've had enough. You got to know your limits to your body, right. And that will bring you into a pain crisis like that.
Yeah. Well, I get in trouble with that too. I played a lot of basketball, get dehydrated, don't call it quits. Just keep playing, and I had to deal with that as well. So I mean, I guess if I just slowed down a little, now that I'm older, I pay more attention. When I was younger, no, I didn't. And it caused me to get in a lot more trouble.
If there was anybody watching, that has sickle cell disease or even a trait, what advice would you give them?
I would just tell them to monitor themselves, know your body, know what you can take, know how far you can take it. Above all else, always keep your fluids up, especially if you have the disease. Not to say people with the trait shouldn't, because everybody needs so much water in their body anyway. And even, like I said, even we already know some people with the trait experience these things
right.
as well. But know your body, know what you can do and what you can't do. And don't go trying to do things that you know you should.
Don't go through the extreme.
Right.
Kyrriel? if there was anybody out there watching that has sickle cell disease, a trait, like what's something that you would want to tell them if they're going through something, or maybe in a hospital, or just watching, just to even get a little bit of information?
Take care of yourself. If there's anyone around you that doesn't know that you have a disease, let them know.
That's good. That's good information. Be informative. Let people know. And if you have sickle cell disease, try your best to be an advocate. Let people know what sickle cell disease is, how it affects your body, as much as you can. Talk about it. Anything else anyone of y'all would like to say?
No, just thank you for the opportunity, to at least get some of this stuff out there. I know. I don't think of myself as an advocate as far as going and putting the word out there, but I do have the disease, so I know that when I speak on it, I speak from my personal experience.
Right.
But I just want to say thank you to you for the opportunity to do that.
No problem. I'm gonna definitely keep on doing it. Oh, let's talk about Worth the Listening Ear. You can let the people know about Worth the Listening Ear, what it's about, and what it consists of.
Worth the Listening Ear is a little business that me and my auntie started. We're actually the same age, and we're just gonna be answering calls. If anyone needs anybody to talk to, we're gonna talk to them, and because it's your words are worth listening to.
Your what?
Your words are worth listening to.
Oh, Worth the Listening Ear. And also they're going to be contacting people like that come out to the event. I do halfway honors ball halfway through the school year, and the people that participate are people that have been bullied, died at the hands of bullying, committed suicide. Well, the families of the people that committed suicide and died at the hands of bullies, people that's dealing with stress and depression on any level. I am a mediator for parents and families, and Kyrriel, along with my little sister Diamond, they are for the peers, the youth that are participating, or even people that not participating that just want to call and talk to someone, just to have a listening ear. They'll be responsible for calling and checking up on these kids at least once a week. They'll be responsible for scheduling outings, events for at least once every month. Just to, just for them to have just for those people that feel like they have no one, to actually know that they have someone, that, that there is someone there that actually cares. And for the parents, I'll be there to be that listening ear. Y'all can contact me at 985-438-0529. That's 985-438-0529. And Kyrriel, you can give me your contact.
My number is 985-713-6624. 985-713-6624.
And that concludes our show for today.